Hi friends, welcome to the Blueprint Nursing YouTube channel. My name is Abby and today we'll be reviewing the medication Albuterol. We'll start by reviewing Albuterol, then we'll work through an NCLEX next generation style practice question together. Let's get started. Albuterol is a medication primarily used to treat bronchospasms in conditions such as asthma, chronic obstructive pulmonary disease, COPD, and other conditions that cause difficulty breathing. Albuterol falls into the medication class known as beta agonists, which work by relaxing the smooth muscle around the airway. This opens up the airways to make it easier to breathe. This is why it's considered a rescue medication, because it helps relieve respiratory symptoms like wheezing, shortness of breath, coughing, or chest tightness in clients with respiratory conditions. Albuterol is available in various forms, including tablets, inhalers, and nebulizer treatments. Let's take a moment to review how to use a metered dose inhaler, as this will be important for you to teach clients when you're working as a real deal registered nurse. Prepare the inhaler by removing the cap and ensure the mouthpiece is not blocked. Shake it well before each use to mix the medication properly. Some inhalers require priming before first use, so follow the manufacturer's instructions for that part. First, tell the client to breathe out, getting as much air out of the lungs as possible. Then hold the inhaler with your thumb at the base and your index finger at the top. Place the mouthpiece between your teeth and close your lips to form a tight seal. Take a slow, deep breath in through your mouth while simultaneously pushing down on the canister with your index finger to deliver one puff of the medication. Hold your breath for 10 seconds or as long as comfortable to allow the medication to stay in the lungs. Breathe out slowly, place the cap back on the inhaler, and you're finished. Now let's take a peek at side effects and contraindications. We just discussed how albuterol does what to the smooth muscle? Relaxes it. So when thinking about the side effects of albuterol, you want to think about the opposite of relaxation. Common side effects include jitteriness, nervousness, shaking and tremors, a fast heartbeat or palpitations, muscle cramps, headache, and dry mouth. Serious side effects are rare, but can include paradoxical bronchospasm or a worsening of breathing, allergic reactions, and changes in heart rate or blood pressure. Albuterol should be used with caution in clients with pre-existing cardiac conditions, such as heart disease and high blood pressure, as well as diabetes, hyperthyroidism, or seizure disorders. Albuterol may interact with supplements, herbs, and medications, including beta blockers, MAOIs, and some antidepressants. So it's important to inform your healthcare provider about all medications you're taking to avoid potential interactions. Keep in mind that beta blockers can prevent albuterol from working properly. Great job reviewing albuterol. Let's work through a practice question together. The nurse is preparing to administer albuterol to a client experiencing an exacerbation of asthma. Which of the following instructions should the nurse provide to the client regarding the use of an albuterol inhaler? Select all that apply. 1. Hold your breath for 10 seconds after inhaling to maximize its effectiveness. 2. Inhale deeply and rapidly through the mouthpiece of the inhaler, followed by a slow exhale. 3. Rinse your mouth with water after using the inhaler to minimize the risk of oral thrush. 4. Shake the inhaler vigorously before each use. All right, go ahead and press pause, make your choices, then when you're ready to discuss, press play and we'll review together. Ready to review? Let's begin. You've got this. When looking at these answer choices, which options stood out to you most? I personally chose 1 and 4, but let's review why. 1. Hold your breath for 10 seconds after inhaling to maximize its effectiveness. This is a correct statement, as this allows more time for the medication to be absorbed deep within the lungs. And 4, shake the inhaler vigorously before each use. This statement is also correct, as it ensures the medication is properly mixed, which is especially important for metered dose inhalers to ensure consistent dosing. Now let's look at why I didn't choose 2 or 3. The second choice is only partially correct, so this is not an appropriate answer choice. While it's important to inhale deeply and exhale slowly, inhaling should not be rapid, as this may cause the medication to deposit into the mouth instead of where we want it, which is in the lungs. The third answer choice is incorrect, as rinsing after using an albuterol inhaler is not recommended. This may be necessary with other inhalers such as corticosteroids, but bronchodilators do not typically cause oral thrush. So the correct answers are 1 and 4. Here are our references. As always, thank you so much for reviewing this topic with me today. Don't forget to subscribe to stay up to date on all things Blueprint Nursing and content review videos. Check out our TikTok live study sessions, crash course, and live study group options. See you next time.